we've set it up so that the patient is seen fairly quickly. From the time of the telephone call to the time the patient is seen, we try and keep it within 4 weeks. My return of a report is within 2 weeks. I've actually never been outside that deadline in my career. And there are times when I will see a patient and my opinion at the end of the day will not help the case. And rather than produce a report, I will contact the lawyer and give them that feedback. And this way they have a choice as to how they would like me to proceed. And throughout this entire process, I do my best to communicate with the lawyer so they know exactly where things are at. I provide benefits to legal professionals at a number of different places. Like me, legal professionals would actually like to see their clients do better. They would like to see them be physically better off. And often they will make referrals to me for the purpose of treatment. And I do my best to help these people get their lives back. So I think everyone benefits there. I also perform medical legal assessments. These are very detailed assessments that I do of patients. Mine are a little bit different than the typical psychiatric assessment. One, because it comes from a slightly different perspective. It's from a chronic pain perspective. And we do a fair bit of special testing as well. So they're very detailed. As the feedback I get is it's been very helpful for the lawyers. Whenever I do an assessment of patients, though, I explain that I'm a physician first. So if there's anything that comes up in those assessments where I feel treatment needs to be done, I will write to the family physician as well. So hopefully, again, the patient's benefits as well in the process. Should it be necessary for me to be called into court to provide expert testimony, I do my best to understand the context in which that testimony takes place. For me, the context of court is a little different than talking with one of my colleagues, because people in the jury are not healthcare professionals necessarily. So my job becomes helping them understand something that can be complicated. I have to be able to explain it in a way that makes sense to everybody. And I'm very careful when I give expert testimony to make sure that I take on the role of expert. And that means that I am a friend of the court. I try not to present a biased opinion in the process. Otherwise, it's not useful to anybody. I mean, I think that the assessment I do is somewhat unique in the world of chronic pain. I'm a psychiatrist by training, but I also have cross appointments in physical medicine and rehabilitation. So I bring to the table a very good understanding of the underlying physical medicine components of the patient's problems, so along with the psychiatric components. So that's important. The type of testing that I'll do in my assessment is not the typical testing that's often used. It's very targeted to the type of patients that I will typically see. I see my role as expert is to be a friend of the court. And that means that I can give my opinion, but it cannot be biased by the person who has asked me to give the opinion. As I tell my colleagues in law, when you ask me to give an opinion, you're effectively asking me to use my time, but you're not asking me to give you the opinion you want. It must be unbiased. Otherwise, my opinion is not helpful to anybody. So I think that's a critical role that an expert has. And also, it's been stipulated in law. 2011, a law came out outlining very clearly what the expert's role is. Fortunately for me, I didn't have to make any changes in my practice because I had always practiced that way. But it's really directed at the issue that there obviously was enough of a problem where it was a feeling that experts were giving opinions based on who effectively was purchasing their time. which is not a helpful thing to do. The other thing that I bring, I think, to the table as an expert is the role of the expert in the courtroom. I think that my job in a courtroom is to help a group of jurors who are not part of my profession understand a complicated problem. And I'm very aware of that role when I'm in the courtroom. I'm very aware of my language to make sure that as I'm speaking, the people in the jury box are nodding, which means that they do understand what I'm saying. Because if I can't explain what I mean, then my testimony is not helpful. The advantage of a colleague in law referring a patient to my clinic under Section 24 of the SABS is that we assess patients in an extremely timely fashion. We do it quickly. We bring them into care as quickly as we are able to. And I think that if patients who are having difficulties receive appropriate care, it makes them much easier for everyone to work with at the end of the day. As patients will say to me, and as I can tell you, someone could give me $1 million today and it would be, a lot of people around me would be very happy, but it won't change me physically one bit. It doesn't help with the physical problems I have. So at the end of the day, although it's wonderful for people to have successful outcomes from their medical legal cases, the most successful thing that can happen for them is to be able to get back into their lives again. And that's the role that I play. So I really see myself in that context as being part of a lawyer's team.